Hi, sorry, I was going to post this video yesterday. Although I did it yesterday, I wasn't in the space to do anything. So this is a soft glam look that I've done today. I saw this inspirational picture of Selena Gomez. I think it's from the Grammys where she did this very polished, soft glam look that is not overly dramatic or theatrical, and I love the look. So we're going to try and recreate this. I suffer from a condition called endometriosis. It's a condition where the tissues from the lining inside of the uterus, called the endometrium, grows outside the uterus. The tissue can grow on the ovaries, on the fallopian tubes, the tube that connects the uterus to the ovaries, the outer surface of the uterus, or organs in the pelvis. Sometimes it can even spread beyond the pelvic area. I've seen a patient who had it in her lungs. Even though the tissue is outside the uterus, it behaves like it's inside the uterus. So around your cycle time, it starts bleeding and breaking down, which causes irritation of the organs inside your gut, inflammation and pain. It can also cause adhesions in your tummy. Although I've never had a cesarean section, my gut is still prone to this because of the endometriosis. So I had a lot of pain yesterday and cramping. And although I went to work, the evening was spent mostly in bed. Um, it's a very difficult condition to treat as well. The exact cause is not fully understood. Sometimes they say it is probably when you menstruate, the blood flows backwards in the pelvic cavity, which can cause a spillage outside the system, immunity problem, genetics. I think a lot of my siblings and other members of the family suffer for them. For a lot of it, for me, is genetic. Um, Treating is difficult. So luckily, because I had my children pretty early, I didn't struggle, but fertility can be an issue, and you do sometimes need laparoscopic surgery to fix this. Often people end up having IVFs and fixing their tubes if it's blocked. The pain, I take simple analgesics, paracetamol, Nurofen, but some people may even need stronger anti-inflammatories such as Ponstant. Hormonal treatment work well, and I am on oral contraceptive pill, but generally after 50 you cannot take oral contraceptive pill, and you got to look at other option. I also have the intrauterine device, the Mirena, which secretes progesterone, and the oral contraceptive pill. Two together does give me relief, but it does not completely make the problem go away. And I don't want a surgery. This is a personal choice. But if you are struggling with severe symptoms and that impacts your everyday function, absolutely that's a option. And also, hysterectomy has been suggested to me. I don't want to do it. I'm scared of surgery, so I'm not going to be undergoing it. I'm just waiting for my menopause. And for me, familially, it's around 55, I believe. So there's a long way to go before I can I will not be having these issues. It's not very often. I don't get it every cycle anymore because of the treatment, but I do get it every now and then. There's some evidence in alternative medicine as well, such as acupuncture in Chinese medicine, giving pain relief. I've not tried those things, but that certainly is an option. But if you don't want to, if you choose to not treat at all, that's an option as well. It doesn't always have to be treated. If you have completed your family and it's, something that is managed with simple analgesics, then that's what you should be doing, because all of these medications and treatments do have advantages and do have disadvantages. Doing nothing, no side effects, no risks such as surgery. Simple analgesics, it's easy and affordable. Side effects are uncommon. When you take ibuprofen or Nurofen, you do have to be aware it can irritate your gut, so you do have gastritis or reflux symptoms. So be mindful. Do have it with food. Don't take it too often. Then 8 hourly. Like the progesterone only medication, you can take it orally or you can have an intrauterine device. The side effects include weight gain, mood changes, acne, hair growth, cramps, breast tenderness, and also it can recur when the treatment is stopped. Combined oral contraceptive pill, which is what I'm on, which has progesterone and estrogen in it. It does reduce pain. It does stop your periods as well if you don't desire it. Shouldn't get pregnant, so it's an oral contraceptive pill for a reason. Possible side effects: nausea, weight gain about 2 plus or minus kilos. So that's a small increase. If you combat it with your diet, it should be fine. There is a small increase though in clots in your legs or lungs, and there are certain contraindications, such as if you get migraines with aura, you have a history of DVT, or you have a history of breast cancer, you may not be a candidate for this. Then there are GnRH analogs. They can cause temporary menopause if you don't desire menopause. They are also called hormone replacement therapy. Periods will stop. They're very effective in reducing the pain of endometriosis, because it stops the growth of the endometrium. Side effects are hot flushes, sweats, vaginal dryness, mood changes. So most of the menopausal symptoms can happen. Then osteoporosis or thinning of the bone happens if you take it for more than 6 months. It can also recur if you stop. The symptoms will recur if you stop the treatment. It's not a contraceptive, just so you know, so it does not stop you from getting pregnant. In Australia, we only prescribe it for 6 months. So all of this didn't work and your symptoms are severe, then please do chat with your gynecologist and discuss surgical management such as hysteroscopy, hysterectomy, and discuss the pros and cons of it. So for this look, I've tried to keep it all very muted. I'm going for a very elegant, polished look, and she looked amazing in that. She has a very heart-shaped face. So the key to applying any influencer or any celebrity makeup is to modify it according to your features, your looks. And I am of Indian ethnicity, and for me, some of the things that are applied on a face might not suit. So we've done a very drugstore based makeup. I will list the product below because I really wanted to discuss endometrium. I haven't gone through most of the products that I have used. This is the She Glam blush. They're very pigmented, quite easily blendable, and I love this product. So much cheaper than the Rare Beauty and does last much longer than the Rare Beauty products. Hence, I prefer this to my Rare Beauty blushes that I have. The bronzer, very subtle because you're softening your features. So I've tried to avoid sharp contouring. This Fit Me pressed powder is so good. It just gives you that photo finish, covers everything. It gives you that seamless mattified look. I did apply some glow filter from Revolution Cosmetics, but I did mattify the makeup because matte look seems to be the trend these days, and I've just tried to do that because I was not in the mood. The first time I did this makeup, I didn't get it right and I did have to redo it. I wasn't satisfied with what I had. So you can see some of the eyeshadow, the powder eyeshadow is on my eyelashes. It's the bane of my life. My thick eyelashes, it catches everything, and if I'm not careful, they don't get cleaned out. So apologies for that. And the NYX Cosmetics powder blush I'm applying, then using my translucent powder brush to just blend it all in and make it all very subtle. This is the Flowers Cosmetics setting spray. This is quite lovely. Keeps the makeup set for quite a long time, and it's not that expensive. So I've tried to use mostly quite affordable products because as I'm learning more and more, I've realized it's in the technique rather than what high-end product you use. And I am not going to the Grammys. I'm not going to the Oscars. Why do I need extremely expensive products? I am just an average person. So I don't think unless you're an influencer benefiting out of it, which I am not, I don't see why not speak the truth. This is the L'Oreal Lumi highlighter. This is in the shade Glossy Pink Ballet, and it's a pinkish shade. This is the only one I purchased. I didn't buy the white or the gold one because I've got quite a few highlighters. I just wanted to try this product. It's quite subtle and you get that highlighted look only when you turn your face, which I like. I don't like in the face highlighters. This is the Maybelline lip liner. Blending this out is key to give that subtle nude lip without harsh lines. Harsh lines make them look artificial, which I don't like. I like a lip that looks that it's just been glossed up and polished a little bit, rather than I've applied lip liner, I've applied lipstick, and I've applied gloss. All of them look separate individual ingredients applied to the lips. So that is what differentiates between a classy and a loud look, which I don't like. Being a mum and a woman is the most beautiful thing you can have, and I never in my life wanted to be a man, but it also comes with certain things undesirable, such as endometriosis, in the package. Thank you for watching and your time. Please do continue to support me. Have a good day, guys.